So you've just been prescribed amlodipine, and you know that in the back of your mind, every medication that's prescribed comes with the risk of unwanted side effects. Maybe you looked it up online and you found a list of nearly 100 different side effects that can happen if you start taking this specific medication. Well, which of these side effects can you actually expect, and are some more common than others? Well, that's what today's video is all about. With marketing of specific medications, drug companies have to file every side effect that is listed and reported by their specific customers. Honestly, a lot of the times, these side effects that get reported don't necessarily have to do with the medication at all. Whenever we as physicians prescribe medications, there are probably 2 to 3 major side effects that we are on the lookout for. And these side effects are in conjunction with how the medication actually works. So that being said, how does amlodipine actually work? Well, imagine all your blood vessels as hoses that carry oxygen-rich blood throughout the different tissues within the body. These hoses are wrapped around with rubber bands. When these rubber bands get tighter, your blood pressure goes up, and when these rubber bands get looser, it'll dilate the blood vessels, causing a decrease in blood pressure overall. It does sound pretty simple, right? You just tighten or loosen these rubber bands in order to optimize your blood pressure, but sometimes this can come with unwanted side effects. Usually blood travels down your leg and then has to return to the heart in order to be circulated by the body. And this is dependent a lot on muscle pressure. Well, if you loosen up those rubber bands around the veins that return the blood to your heart, sometimes it can cause those vessels to dilate a little bit too much, leaking fluid into spaces where it should not be. This is the most common effect that we see with amlodipine, and that is extra fluid buildup in the lower extremities. The fancy medical term for this is known as peripheral edema. So this can be fixed in 2 ways. If your blood pressure is still high on the amlodipine, we can add a second medication that can help sort of offset the effect of the extra fluid, like in the form of a water pill. Or you can just add on something like compression stockings that helps force that fluid upwards back towards the heart. And the third option would be just discontinuing the amlodipine and trying a different medication altogether. The other main side effect that we look out for is amlodipine can sometimes cause individuals to feel a little bit flushed or a little bit warm. And this makes sense. If we're loosening the rubber bands around the blood vessels, we have increased blood flow to specific areas of the body. Blood is typically warm, so increased blood flow to areas of the face will give that flushed sensation or maybe make you feel a little bit warmer. And lastly, this is more of a general class effect of all medications that are used to lower blood pressure, but sometimes we can overshoot our goal to lower the blood pressure, and this can make people a little bit dizzy, lightheaded, especially going from a position of laying down to standing up very quickly. So this is how amlodipine works. It'll loosen the rubber bands around the blood vessels, and it can sometimes lead to some side effects such as peripheral edema or having fluid buildup on the legs. And it can cause some facial flushing and increased feelings of warmth. If you found this video helpful and want me to cover a different medication, please leave a comment down below. Thanks for watching, and I'll see you all on the next one.